Okay. Hello, everyone, and welcome to the 2021 Governor's Summit on Early Language and Literacy in the session on Collaboration in the Valley, a case study of the basics. I am Cheryl Cooper Smith, and I am the program manager at the Deal Center. I will be assisting the presenters for our session today. A few housekeeping items just to get us started. We encourage you to use the chat box to ask questions and share comments. We will hold questions for the presenters until the end of the session for discussion during the Q&A. Participant handouts for this presentation were available in the auditorium, so I hope you had a chance to access that information. It was below the join button and description section of the page. Please use the drop-down menu in the chat box to direct any technical questions directly to me, and I will respond as quickly as possible. Please remain muted throughout this session. And so now I am excited to introduce Grace Nagel, Helena Coates, and Warren Steele, our presenters for today. Let me share just a little about each presenter. Ms. Nagel is the director of the Basics Chattahoochee Valley for the United Way. Mrs. Coates is the chair for the Birth to Pre-K Committee. And last but not least, Mr. Steele is the chair for the First Readers of Muscogee County. Welcome, presenters. I am going to stop sharing so that you all may go ahead and begin sharing your presentation. Fantastic, things look good. I can see your slide.
Fantastic. All right. Well, thank you so much for having us, Cheryl. We're so happy to be here and share a lot of the work that we are doing in the Chattahoochee Valley. And on that note, I'll pass it over to my colleague, Helena Coates.
Thank you, Grace. I appreciate that. Cheryl, thank you for being our IT and our communique and our liaison and, right? So you guys are wearing lots of hats today, and we appreciate the support that you're giving all of us in allowing this entire group to be a part of the Governor's Summit today. So thank you for having us and allowing us to share with you guys what we've been doing here in the Chattahoochee Valley. We have some really exciting things going on in our area, and we look forward to sharing some of those with you this morning. So you're going to hear from me a little bit, and I'm going to kind of, in essence, give the case for how we got to where we are today, and share a lot about how one of the things that was most important to us was really that partner engagement and that development as we were bringing the basics to the Chattahoochee Valley. Grace will then share a lot of our collective impact work that she has been working on here over the last year that she has served as our executive director. And then lastly, you'll hear from Warren, and he's going to give you a hands-on approach to specifically one of the partners, how they've utilized the basics in the work that they already do in the communities that we serve. Next slide. So a lot of what we do, in fact, if any of you participated in Mr. Williams' session last block, one of the questions at the end was, here's our situation at the library, how do we do it? And his answer back was, you got to do the research, right? Because your research is really going to drive the work. And that's what we did here in our community. Back in 2015 or 16, we embarked on a regional prosperity initiative for our community. We studied 7 counties in our area, so not just Muscogee County, but several other counties that surround us because they're so impactful on what happens. And together we know we can do better. But we wanted to be competitive in markets, particularly markets our size. And we found some key indicators that really shared how we were different from other markets that our size, particularly in population growth. So of the 61 metro areas that we studied in our RPI, the Regional Prosperity Initiative study, and they were surrounding all states kind of in the Southeast area, we were 58th out of 61 communities that we studied as far as how slowly our population was growing. We were also one of the lowest, with those who were the lowest percentage of those who 25 and older had bachelor's degrees. And then on top of that also impacted our poverty rates. And right now we sit at about 21.8% in poverty rates, which was higher than all the other communities that we were studying against. And we know these numbers, these are the kind of things that businesses look to invest in, to bring their companies here, to bring their headquarters. They need a talent pool. So all of these became real drivers for what we needed to do to change our communities. Next slide. So here we came up with Columbus 2025. And this became our region's strategic plan for a stronger and more vibrant region. We had 3 guiding principles that helped us get to the place where we are now, and increasing prosperity, improving our quality of life. And in particular, we really wanted to focus on reducing poverty. In order for us to achieve those, we developed these 5 action areas, right? Talented, educated people, targeted economic growth. You can read the rest there on the slide. And in particular, one of the most important action areas became the talented, educated people, because we knew without that, we couldn't have these other 4 pillars for our community's action plan. So a lot of resources and time were really spent in developing this particular area. That's in fact where I sit. I am the chair, as Cheryl said, of the Birth to Pre-K committee under Talented Educated People pillar. And you know, we spend, if you think about the amount of money that we spend in resourcing resourcing children, we start spending a lot of money on them when they get to school, right? In after school programs, obviously for school, and extracurricular activities. But what about those children who haven't gotten to school yet? Do we wait until they get to school, or do we start immediately? And a lot of what we studied noted that if we do not start at birth, every child will be behind. Next slide. So how did we get to the basics in our community? So as a part of that Birth to Pre-K committee, we did a community-wide approach to early learning. We wanted to study all of those organizations and partners who already work in this space, because there are quite a few. This is not obviously a new idea to the area of engaging our children at birth. So we talked to them. We spent over 2 years sitting down with them one-on-one, doing surveys, collaborating with them, meeting, and looking at what their needs were, and in particular, what our children's needs were at this age. So the research is clear. I'll share that with you in just a few minutes. But most important to the work that we wanted to achieve, not only from our community's plan in Columbus 2025, but in Birth to Pre-K, is we wanted to align our resources to have that collective impact. In fact, I will say, as we were kind of building what the Birth to Pre-K committee, its impact in the community was going to have, we were also going after that collective impact grant from the Deal Center. So the timing and the alignment of both of these resources were really, it couldn't have been a better timing for that. And we used a lot of those approaches and what Mr. Williams talked about specifically in his last session, in engaging our own community through this process as well. You know, as we were studying this too, we said we don't want to take away from all of these organizations who have phenomenal programs. We did not want to say, yours doesn't matter, ours is more important. We wanted to find that approach that where we could all work together, finding common language, utilizing common resources, and all working together toward the end goal. And that's where the basics came into play. This was a particular initiative that enhanced other programs that were out there and did not replace. And it allowed us to utilize the principles that he has, these 5 principles, and you see them on your screen now: maximize love, manage stress, talk, sing, and point, count, group, and compare, explore through movement and play, and read and discuss stories. So I'm sure you will hear a lot more of those with Dr. Ferguson if you choose to participate in his piece a little bit later this afternoon. But I just wanted to share what the framework of what the basics was. And specifically in the research we found is this is exactly what we needed to achieve with our children who were young. So I shared with you how important the science was and the research. Next slide. So when we were looking at this again, we studied brochures and what the scientists were saying, and the basics really collaborated on a lot of these pieces that were already out there. In particular, you can see for many of us maybe who are visual, by 2 years, children have already done 80% of brain growth by 2, right? So what happens if we wait until 4 at preschool? We've really missed the mark on really important stages in children's lives. And then also what was very clear are the national data showed by year 2 that there were already some significant skill gaps. Specifically in those with race, ethnicity, and socioeconomic status. Again, addressing our poverty rates here in the Chattahoochee Valley. So again, just another visual here showing, look at the gap between age 2, between those who, had been intervened and developed cognitive skills from birth with language, with stress management, with love. It might be small at age 2, but that will exponentially grow as these children get older. And if you already come to school with a lack of knowledge of just understanding words, understanding commands, it makes it harder for you to learn as the teachers are discussing. So, I mean, look, by age 17, by the time it's time to graduate, you've got a huge gap of 3 to almost 4 years of language and development differences. And this impacts our children graduating. It impacts if they go to college. So we knew we had to intervene early. Next slide. So we went about it with a collaboration of sorts, and you'll see kind of 4 of the really key players here, in getting the basics to Chattahoochee Valley. We talked to Dr. Ferguson, and we also talked to several other communities who had already engaged in this work of the basics in studying them. But our mission was very clear. We needed to get with our parents, with our caregivers, and address the children's needs starting from birth. We could not wait. We spend too much money trying to catch up if we don't start from birth. And our mission essentially is just to narrow that gap, right? Inevitably addressing our poverty rate and improving the quality of life for our children. So we collaborated with some phenomenal groups. Columbus 2025 kicked off with the basics, and we partnered with the United Way of Chattahoochee Valley. And, you know, the United Way model specifically, they really already fulfill education and basic needs in their service model. And so partnering with them became a critical asset for us as we were not only utilizing that collective impact approach, but also in their ability to scale and the partnership development that they had already done. So we reached out to the Community Foundation of the Chattahoochee Valley, who were always very interested in our work with the basics and what we were doing there in the birth to pre-K area. And they agreed to give us a 3-year grant to fund an executive director who works underneath that United Way platform. So the synergy and the partnership that was already created really from the beginning was a critical piece that helped drive us to that next phase. Next slide. I'll share with you just very quickly what our timeline looks like, because, you know, I think it's important as we all start the discussion of how do we do this in our own communities? What's the next step? What's the first thing we do? And a part of that discussion is it's never fast, right? People have been working in this space for decades. But what's more important is that we keep at it and that we continue to chip at it. In fact, that was a very regular comment in our early birth to pre-K committees, is that this is not a one and done, we're finished in a couple of years. This is for the long haul. We're here for 20, 30, 40, 50 years in order for us to make an impact. So we started obviously with studying our community back in 2016, initiated those 5 action areas that I shared, and then spent a good 1.5 years talking with all of our partners. We had 60 plus partners who we did one-on-one conversations with. We met together. We engaged our community and got them excited about the basics before we even thought about kicking it off. We wanted to make sure this was the right approach for our community. And we needed to ensure that we had the collective, I'm going to steal it, the collective impact of all of these partners who were willing to engage in this work together. So we launched the basics in May of 2019, a little over 2 years ago. And it really was a phenomenal community engagement piece. We had 300-400 people who came to our kickoff. We brought in Dr. Ferguson and allowed him to share and get people excited about it as well. And I was excited about it. I thought we had probably one of the best kickoffs, you know, they've ever seen. And so I asked Dr. Ferguson after probably our 4th session with him that day, and I said, so tell me, how did we do? Wasn't this great? And he looked at me just as stern as possible, and without a hesitation, he said, if you really are committed to this work, you have to get an executive director. You have to find someone who is not volunteer based, but someone who works in this all day, every day. So that was a great takeaway for me from this kickoff, is that we had to do something to get a person who was going to lead these efforts. In establishing kind of that community or the work plan for the basics, that was one of the first things we put in there, is we've got to hire a full-time director. So through the areas that we were able to focus on with specifically, again, the Community Foundation and United Way, in June of last year, we were able to hire a full-time director and then expand the basics into the communities of Georgia that we serve. I couldn't be more thrilled with the executive director that we chose, which is a perfect segue into hearing from Grace how we got started and what our focus areas are, and how we'll continue to grow and expand with our partners. Grace?
Thank you, Helena, so much. It's honestly just been, this past year of coming on in August has just been a wonderful opportunity to build on the partnerships that you all have established over that multi-year time frame and to really scale up the work that we're doing. And I know we're making great strides in the work to get the basics into the families in our communities, especially those who need it most. So I'll pick up on why collective impact. And I think Helena did a really good job of saying, that this process isn't easy. It's a multi-layered, multi-year, multi-step approach. But ultimately, you can see that we had a very clear community goal of improving early language and literacy for children in our community. And that community goal will translate into long-term success and benefits for our children. There's a couple of ways that we were looking at how we can measure this goal. And obviously, one of the main tools of collective impact is common measurement systems. So things like increasing the number of quality rated childcare centers, increased enrollment in pre-K programs, preparing students to enter kindergarten and increasing those kindergarten readiness scores. And I'm sure a very common thing that you all may have heard of in your line of work is reading on grade level by third grade is of pivotal importance when assessing a community's ability to ensure that children receive the education they need to become successful later on in life. Our main goals that we're looking at for our impact are going to be these kindergarten readiness scores and third grade reading levels. That will sort of indicate to us that we've had a measurable effect on our community. And the collective impact, how do we get there? And that's going to be creating that common language, using the basics as a tool, as Helena was saying, not to supplant or uproot any other program that our community was already engaged in, but to enhance it and to give them another tool where they can talk with another organization, maybe one that they don't even think is related to early childhood education efforts, but to have that common language of the basics in the work. You can see from our Columbus 2025 strategic plan that we have a common agenda. We have common committees like the Birth to Pre-K committee that really guide community-wide efforts on topics like early language and literacy. And of course, the metrics. Metrics are always really fun, and I kind of consider myself a monitoring and evaluation nerd of sorts. And this is one thing that we are really growing on and expanding, but have pretty good foundations on. And I'll talk a little bit about that later on in our presentation. But ultimately, the role of the basics in our collective impact approach is increasing our partners and our other community organizations' capabilities to have the basics really be sustainable, that a few years from now, they won't even have to think about what the basics are, they'll know, and having it as a tool in their toolkits, doing the work that they already do to make it more successful overall. So you can see our implementation strategy is really in three parts. Helena did an excellent job about talking the developing partnerships aspect of it. And that's something that is ongoing, nurturing the relationships that we forged back in 2016 when we were looking at bringing the basics to Columbus. We have to continue to nurture those relationships and to bring new communities and new partners into the fold as well. The second part is going to be that outreach and awareness piece. Because so much of our work is partner-based, and because even in my role as the executive director, I cannot do it all. We rely on the work of our partners to get our message out into the community. And that involves us giving them the knowledge, skills, and abilities to take the basics, make it something that they own as an organization, and then can share with the people that they serve. And part of that aspect is also the third piece, which is the socio-ecological saturation. This is a term that Dr. Ferguson uses all the time when he's discussing the basics. And essentially for us, it just means that every organization that serves children or touches a child's life in some way needs to know about the basics. And that's ultimately our goal when we look at what sectors are we trying to reach out to? What are our priority sectors given the time of year or given any other constraints in our community? And all three of these really guide our vision, guide our work, guide our activities, guide our planning. So I want to talk a little bit about these outreach tools. One thing that when we as a community were looking at an early childhood program or another initiative, was the quality of the materials that were available for distribution. And the Basics has a wonderful toolkit that is readily available for free for Basics communities to share with their partner agencies. And if we're looking at having that goal of creating a common language where we can say like, oh, well, how is your organization sharing the Basics? How are they using Maximize Love, Manage Stress with the families that they serve? Having quality tools is going to be of the utmost importance in getting that message across and building that language. You know, we don't wake up and start doing a collective impact process and we start writing in Shakespeare, right? We have to learn our alphabet. We have to learn how to speak in that language before we communicate fluently in it. So the Basics Learning Network Community Toolkit is one that is available on our website, as well as any of the other websites affiliated with the Basics. And they have all different kinds of materials available, from posters, postcards, magnets, resource guides, intensive training manuals, basically anything that you can think of, videos, any tool of almost any medium, and also available in a variety of languages, which is really great because the Basics are beneficial no matter what language you speak at home. So we wanted to make sure that everyone in our community, including those who maybe do not speak or read English, would also have access to those materials as well. One way that we've also been able to tailor a lot of the resources on this community toolkit is via sector presentations. So the way that you might share the Basics messaging should be targeted to each sector. And the way that we saw it was, how are we going to share the Basics with the healthcare community? And even in the healthcare community, how are we going to let a physician know, or a nurse, or an RN, or maybe even a clinical worker, what their role could be in sharing the Basics with families? So making sure that you have a message, a presentation that's tailored to these specific sectors and also the specific audience in these sectors has been really important for us. And we've been able to develop some pretty good presentations, in my humble opinion, that we can use with a variety of sectors and that are constantly evolving as we get more information and more feedback from our community on what works for them. We cannot neglect the importance of social media and a digital presence, especially given the time of the pandemic where we're not able to do as much face-to-face outreach as we would like. Social media has really been transformative in helping not only us get messages out to parents, but also community organizations with a social media presence can link to our page and we can link to them, which really encourages that collective impact approach where we're sharing resources with each other. Our Facebook page, we post daily from Monday through Friday, and on Instagram, we post weekly. And the things that we normally post on our social media pages are going to be tips and tricks related to a basic of the week. So for instance, if we're promoting Explore Through Movement and Play, which is our theme for this week, we might include some really important facts about your child's development, an activity that you can do with your child to practice that particular Basics principle, and some other parent and community resources that might be relevant to people looking at our page. We've also had tremendous ability in creating more locally produced tools. For instance, we had a corporate partner of the United Way who was able to develop rack cards and bookmarks for us. And these have been truly invaluable resources, either for outreach events, to give to a pediatrician's office so that they can include them in patient education literature. They have really just been wonderful ways for us to engage in the community. Standing banners have also been really fun things for us. There's a lot of uses for standing banners, not limited to just outreach events and kind of making an aesthetically pleasing name for yourself, but also as tools that you could have in office settings, corporate settings, as a conversation starter for people to go, what are the Basics? I'm curious about that. And of course, digital and TV advertising. We were able to partner with two local news stations, one to do a digital advertising campaign and the other an on-air TV campaign. And combined, we've made over 200,000 impressions in our community to share the Basics directly with families who need to hear our message. So the importance of having high quality outreach tools in the collective impact process cannot be understated. And I hope that you'll be able to check out some of those tools and see how you can use them in your communities. So that third model of the socio-ecological saturation is everyone has a role to play in sharing the basics. And you can see this really excellent graphic here of a family surrounded by different types of sectors. And you see the traditional ones from hospitals, childcare centers, churches, libraries, schools, to maybe some less traditional ones like housing developments or homeless shelters, barbers and beauty salons. Any place that a child will come into contact with their parent or caregiver needs to know about the basics and know how to share it with families. And one thing that we found that's been really important, like Dr. Ferguson said about, if you really care about this work, you need to have an executive director. Well, we also found that it's really important to cultivate a basics champion for each sector and also for each organization. And this person would be able to help you with connections, with gaining a new perspective, as well as being another voice to add who is sharing your language and sharing your material with other people who need to hear it. So I want to talk a little bit about some of the sector work that we have been doing. And our sectoral approach so far, we've really targeted three main areas, and those would be healthcare, early childhood education, and community organizations. When we were coming on, and me coming on into the role in particular last year, I only have two hands. So we really had to maximize what areas do we want to target first. And we came up with these three as sort of a introductory way for us to share the basics in the community. So healthcare has really been a priority engagement for our community, pandemic notwithstanding, but especially during COVID, because it continued to be operational. You know, children continue to get sick and they need vaccines and they need well child checks. And healthcare champions are such great messengers. They make excellent champions for any kind of work that you do, but particularly in early childhood development, because they understand the science of brain development. They are trusted communicators to families who, are constantly bombarded with different information all the time. Having a physician who's able to help them sort through material is really powerful, and having a respected physician in your community is an excellent way to help get your message across. You can see in our picture here, this is Dr. Susan McWhirter of Rivertown Pediatrics, and she is our foremost basics healthcare champion in the Chattahoochee Valley. It's a funny story of how she came on, who are the right people in the room and who need to be part of these discussions of collective impact. Dr. McWhirter was asked, we're looking for a healthcare champion and we want them to do X, Y, and Z. Can you help us find this person? And she said, I think I'm your person. I'm right here. I would love to do it. So knowing who to ask and knowing who to be partners with you on that is really transformative. And I can wholeheartedly say that we would not be where we are today in the healthcare sector without Dr. McWhirter's connections, without her assistance, without her identifying key players. So everybody needs a Dr. McWhirter in their community. I cannot stress that enough. So some of the work that we do has been really trying to get as many people in the healthcare community actively engaged with the basics as possible. That includes identifying a network of pediatricians who are curious about the basics, who receive staff training about the basics and how they can promote it at their own practice, creating a network that meets quarterly to sort of discuss ways that they're sharing the basics, any upcoming healthcare events or any concerns they might have. And we provide staff training, we provide materials resources like those rack cards and bookmarks, like standing banners, like brochures, and also engagement to kind of share the news of what we are doing in our community. We also have two major hospital systems in Columbus, which are Piedmont Columbus Regional and St. Francis Emory Healthcare, both of which are connected to greater statewide hospital systems. And at the time of the creation of this presentation, we did not have a formal lead champion at Piedmont Columbus Regional, but we do now. And this individual has said that they will help us on a working group to make sure that the basics becomes a sustainable part of our hospital system, everywhere from the children's emergency department to labor and delivery and beyond. So we're really thankful for all the connections in healthcare that have helped make this possible. Our second sector is early childhood education, and educators, much like physicians, are trusted communicators, and they also see every day the impact that the basics have on children's emotional well-being, their social and their intellectual well-being and development. So having them be able to share with parents what the basics are, how to communicate them with everyone is really important. And you might think to yourself, well, hold on, you said the basics are for ages 0 to 3. Well, the benefits don't stop. There's no hard stop at age 3. And my greatest philosophy for this is something akin to the best time to plant a tree was 20 years ago. The second best time is now. It's never too late to get families interested in the basics and practicing them with their children. So one thing that we've been doing is really partnering with a lot of our Head Start, early Head Start, and pre-K educators to get them trained on the basics and sharing those messages with others. Enrichment Services is a large community organization that operates a lot of our Head Start and early Head Start programs in our community. And we've been able to train a lot of their new employees at their pre-service training. In September of last year, we were able to train over 90 new employees of their 6 service centers in some of our northern counties in our catchment area. And they're a fantastic partner for us. They have hanging banners at all of their childcare centers, and they also communicate our basics information with families during case management meetings. So they're an excellent partner to have in a variety of work. And we've also been able to do a lot of pre-K trainings with our school district. And we've most recently been able to do one with our partners in Phoenix City. We have others scheduled for our Muscogee County School District with scheduled follow-up because educators need to know about these practices that they can share to empower parents to be better teachers as their children's first teachers. Finally, community organizations. And I think every organization present at the summit today has been challenged with finding new and creative ways to engage the families that they work with. And we have also been faced with similar challenges. And fortunately enough, we have such a really connected network of partners that are thinking outside of the box to engage families, particularly as we saw increased needs go up during COVID and decreased availability of resources. So I'd like to share 3 examples of some really fun work that we've been able to do with the basics. The first one is a partnership with the Springer Opera House, which is the State Theater of Georgia. And yes, not every community in Georgia will have the State Theater of Georgia, but they've been an excellent partner for us. The Springer has a program called Theater for the Very Young, which essentially is like the magic of live theater on training wheels. So it's a place where families with children ages 0 to 5 can bring their children to a place where they don't have to sit still, they don't have to be quiet. And we've been able to partner with them on 2 different productions so far, where the basics are integrated into the structure of the play, demonstrated in real time, and materials given to parents when they leave the performance so they can practice implementing them with their children. You can see on the far right picture, you might be able to detect one of our sandwich boards with our basics logos on there this is planes, trains, and things that go Zoom. So really creative, really fun ways to engage not only a trusted member of the community, but also get parents involved in an activity that's fun. Secondly, we were able to partner again with Enrichment Services to do a rat card distribution at a community event. We had a community grocery giveaway and vaccine clinic, and we were able to give out more than 600 different rat cards at this event, which is really, truly powerful. They always throw amazing community events, and they're always so kind to invite us in there and train their staff on the importance of the basics as well. Thirdly, because literacy is so important, and the importance of libraries and community literacy organizations cannot be overstated. We have been able to partner with Read for the Record Day, which is sponsored by Jumpstart, and in partnership with the Columbus Public Library, First Readers of Muscogee County, and the Literacy Alliance, we're able to pre-record a virtual reading of Evelyn Del Rey is Moving Away. And if you're not familiar with the Jumpstart Read for the Record Day, it's a day where communities all across the country gather together to read the same book on the same day to celebrate early literacy. We were able to pre-record this event, launch it on Facebook Live, and record a small message about the work that we do in our communities, and sort of give a little plug for what we are able to do in the services we provide. And we have with us today the chair of First Readers of Muscogee County, who is an excellent partner of ours, Warren Steele, and he has been tremendously connected from the very beginning with a lot of the work with the Birth to Pre-K Committee and Columbus 2025. His presence and work in the community can also not be overstated. And with that, I pass the baton along over to Warren.
All right, thank you, Grace. Good morning, everyone. Almost good afternoon, but not quite. It's a pleasure for us to be part of this presentation. We do value the partnership with the Basics. And also, we are happy to spread the message about what First Readers does. The read and discuss stories, read and discuss books portion of the Basics is where I feel we are the fulfillment tool for that pillar of the Basics. I would like to give a little background on how I came to be involved in this space. I started the Muscogee County chapter of First Readers in 2012. After tutoring and mentoring with elementary schools and seeing 3rd to 5th graders not able to pronounce 2-syllable words, I realized to help these kids improve their reading, we had to start earlier. After reading an article about Robin Ferst and First Readers and seeing my own daughter marvel at receiving her monthly Highlights magazine, I started to believe that mailing books into the home was a potential solution. As I learned more, I began to realize and understand the critical importance of that birth to 3 timeframe. I started to see a big flaw in our educational system. We don't start formal schooling until kindergarten, 5 years old, maybe 4 if you're enrolled in a pre-K program. High quality daycares can start sooner, but too many kids are being left behind because the parents don't understand the need of that early engagement. What I was learning and what the Basics confirms is that 4 years old is too late, as you saw in the developmental gap slide that Helena showed. And if parents don't understand their role as a child's first teacher, those kids start school behind. If you would have asked me when my oldest son was born, I would have said, he'll learn to read and count in kindergarten. I read to him and played with him because it is what my parents did with me, fortunately, but I did not understand how important that interaction was. So if you can imagine parents who have not had those rituals passed down from their parents and not been educated on the importance of those first 3 years of life, those kids are at risk of starting school behind their peers in more than just literacy skills. I met Robin Ferst at a Voices for Georgia's Children event and discussed the organization and decided to bring it to Muscogee County. And so you can see the first mission here. And a little background information on First is on this next slide. First was founded in 1999 by Robin Ferst Marhaver in Madison, Georgia. Today, we mail more than 45,000 books per month throughout the US. We have 108 community chapters, mostly in Georgia, but also in these other states. At the local levels, we are all staffed by volunteers. In Muscogee County, again, we started our chapter in 2012. Since then, we have mailed over now 270,000 books to over 10,000 different children. We have around 3,000 children per month receiving books. In Muscogee County, we have around 15,000 children under the age of 5, and close to 1/3 of those, or 5,000 kids, live in poverty. In 2012, I felt like the Lone Ranger in the wilderness here in Muscogee County. Only one of our pediatric practices was using the Reach Out and Read platform for their patients. And you won't be surprised, it was Dr. McWhirter's office. and the health department's Talk to Your Baby campaign had not started yet. No other organization was focusing on that birth to 5 timeframe. We became a United Way partner agency in 2016. At that time, the United Way president said, "We have a lot of great after school and summer programs for kids 6 and up, but none of our partners is delivering support directly to children not yet in school. It's a hard demographic to reach, especially for those not in daycare. And as I learned that most daycares in low-income areas have no books for their children, I knew Ferst had a role to play." When I joined our Columbus 2025 Talented Educated People Committee, and specifically the Birth to Pre-K subcommittee, I felt excitement that our efforts were being supported and amplified by the broader community, and the message would be spread wider and faster. The Basics doesn't and didn't replace anything for first readers in our area. It actually enhanced it. Our mission became better understood and better supported. The Basics with scientific data helps explain the why of what we are doing. So as you can see, this slide helps show the positive impact of this collaboration. Now I say, and we discussed this within Ferst, the one weakness in the Ferst program is we rely on the parents to understand their role. We provide the tools. We have age-appropriate books. We have a parent newsletter. We have parent engagement training modules. We have parent engagement videos on our website. We have activities to conduct with children. But what we really need are the partners who regularly interact with the parents, whom the parents trust to explain the importance of their role. I remember one story where we would call locally newly registered parents and welcome them to Ferst and make sure they are receiving the books. When I asked one parent if she was reading at least 30 minutes each day with their 6-month-old daughter, she responded, "You know she can't read yet. I'm putting the books on her bookshelf until she's old enough to read." It shocked me, but it reinforced that as well-intentioned as most parents are, if they don't know what to do, they're probably not going to do it. We were already developing relationships with daycares, with the birthing hospital, pediatric offices, the barbershops, WIC, Head Start, the library, and I saw a question pop up earlier, and with Fort Benning. We work with their family engagement coordinator at Fort Benning. But we were doing that piecemeal, one-off. With the Basics, with its focused approach and broad community engagement, it has made those interactions much easier for us here. Now I've included this last slide of one of our monthly newsletters to show how we participate with the Basics to spread their message to our 3,000 or so families each month. We highlight activities to conduct with their children based on the book being mailed that month, but we also highlight certain pillars of the Basics to help spread the message. Again, we have been happy with the partnership. I do believe our organization has grown in Muscogee County since the introduction of the Basics, more so than we would have before. And without the Basics, I do not think we would have had the level of support from our funding community, and we would not have had the number of children registered without their involvement in the community. So thank you for letting me present. Turn it back over to you, Grace.
Thank you so much, Warren. And we are also thrilled of the partnership with First Readers of Muscogee County and in all the work that you do for literacy in Columbus and the surrounding area. So thank you again. Thank you again for making yourself available for this presentation piece. So I'd like to round out and finish up with an evaluation of our work. So a good case study, we lay out the case for our why, and now we're going into the how and the what, and what will we do better. So I think one of our strengths, you can see, I think we have quite a few more strengths than challenges, but our strengths really include a lot of these strong partnerships and foundations that were engaged early on into this work. We already had, you see, like Ferst Readers, founded in 2012 in Muscogee County, doing a lot of work in literacy. And we have a lot of committed individuals and organizations to help champion our work. Also, the affiliation with organizations like the Basics Learning Network. It's a global network of practicing basics communities, but also affiliation with the Deal Center, the United Way of the Chattahoochee Valley. All of these partnerships that have given us resources and given us a platform has been a very wonderful strength to have. We also have very vocal, visible champions who have community trust sharing our message. And of course, dedicated full-time staff, yours truly, to help expand the engagement efforts. A couple of our challenges, I think the first one goes without saying, that the pandemic has really limited our direct outreach. But fortunately enough, I think going back to that strength of our partner organizations in that network, we're able to work collaboratively to creatively problem solve and get material into the hands of families. A virtual environment for training is a little bit less than ideal. And oftentimes some things are, you don't see the full picture from a virtual platform, but that's also hopefully going to change soon as cases continue to decline. And I think the biggest challenge that we have so far is measuring our impact. And I think as a grant funded program, this is one of our perennial questions of how are we showing that we're really making the difference that we say that we are. I think we're doing an excellent job of measuring outputs in terms of number of people that we trained and number of staff trained and number of RAC cards distributed. But how does that really end up to our overall goals that we mentioned in the beginning of increasing kindergarten readiness and having third grade level reading proficiency? I think now that as we expand with the Deal Center, sharing the basics and promoting the basics to 10 new communities across the state, and the creation of the Basics Learning Network of Georgia, where now all of these new communities, 11 total, including us, are going to be measuring the same things and trying to work on the same communal goal. So I have a lot of hope that moving forward, we'll be able to measure our work, find out what really works, maybe tweak some things that don't work as well as we think they could have, and really make a tremendous impact on the state of Georgia as a whole. So moving forward, you can see that we had our 3-sector outreach of healthcare, early childhood education, and community organizations. We're looking to diversify not only within those 3 organizations, but expanding to include housing, child welfare services, the faith community, and others to bring them into the fold. And I believe we will have a tremendous opportunity with the Basics Learning Network of Georgia, as we were the first community in Georgia to adopt the basics, that we can help share our message and some of our growing pains along the way of how to make these new communities as effective as they can possibly be. So there's a lot for us to look forward to in this development. And I hope that you will be there to champion not only our work in the Chattahoochee Valley, but across the state of Georgia. And thank you again to the Deal Center for making this network of Georgia possible. And on that note, I believe we have time for any questions, and I will stop sharing my screen.
Okay, thank you for such an informative session. It was such great information. We do have a question. I saw that we have a question here from Ms. Sarah Lee, and Mr. Warren kind of addressed a little of the question, but I'm going to give you some of the information in more detail. So the question is, how much of your data contains information from Fort Benning? That's one part. And then what partnership do you have with them if they are included?
I think that's an excellent question that I do know we capture some data. Helena and Warren, I might want your input on this as well. I think they're counted partially for us, but yeah.
So Fort Benning was absolutely included in our Regional Prosperity Initiative and the studying that we did. Fort Benning is a huge contributor, as you all know, to our community. So without their data and without their information, our information wouldn't have been complete. So they were absolutely a part of the study when we were working on these numbers. How do we engage them now? So Fort Benning has always been a solid partner in participating with Columbus 2025. Our community's plan. In fact, they serve on the, I don't remember who it is at this point, but somebody serves on the implementation committee. So
Right, Mike Burns. Yeah.
Thank you. Mike Burns does. And so they've always been a part of the process. But if I'm being honest about how much we engage Fort Benning from the basics perspective, we have work to do. In fact, we did find early on that was one community, so to speak, right? One sector that was a little bit harder for us to engage in conversation with. So there is no doubt, Sarah Lee, I think you're the one who had the question there. There's no doubt that we have work to do with Fort Benning and engaging them more in our process. And so, again, as we look to expand and reach additional sectors, they're absolutely on the list.
Mm-hmm.
Okay.
Absolutely.
Do we have any other questions? Thinking about some of the action pieces that you saw. So it was a major process that they had to undertake before actually implementing. And then some of those innovative action components that they have been able to infuse into their communities. Does anyone see how maybe this could be something that you could try out in your communities? Or did you find some interesting information that would enhance what you're already doing?
Yeah, well, let me just say I'm not necessarily addressing that specific question, Cheryl, but the basics it's not necessarily a product or a service. It's a way of life. And because it is a way of life that is critical for every child's development, every person should be involved with it, right? You name it, a CEO, a parent, a grandparent, a guardian, anyone who engages with children. And that's why that cross-sectoral approach is so important, because some people may laugh at hitting the barber shops and the beautician shops, but kids get their haircut, and moms get their haircuts, and dads get their haircut. And so we want the barber to look at the kid and ask questions and engage. So this way of life impacts every single one of us.
Absolutely.
We have a comment here and a question, looks like. Wendy asked, I'm fascinated by the how it works for Ferst books. What are the costs to make that happen in a community? Good question.
I'll say, the books are free to the kids, and Robin Ferst's philosophy, and is what we live with, is any child who's not read to from birth is at risk of starting school behind. So it's not an income-based program. Every child's eligible. But what we do is we focus on the low income service providers, the WIC, the Head Start, some of the daycares. The cost of the program is we do local fundraisers here. We will write grants for funds. We have, letters that we'll send twice a year to individuals. And then we'll have do a fundraiser once a year. So the cost of it is $36 a year per child. So it's $3 a book is what we, pay for. So it's very inexpensive. And I think in other communities that you could go to the Ferst website, we have a whole team that would be helpful in getting a community program started. We have a lot of resources to help someone get started in the community, to identify where you're going to look at the funding, libraries are good partners. Like I said, the United Way has been a great partner. And then, of course, with the basics here, it really has made a big impact. But it's individual fundraising from the local community to support books mailed into the community, but books are free to the families.
Thank you, Mr. Steele, and all of our presenters for sharing the details of the process and the procedures on how your community combined the collective impact approach and the basics to have this impact on the pre-K through, or the birth through pre-K early language and literacy development in your communities. It's nothing like hearing about it in action and seeing the experience of those involved. Everyone, if you would like to learn more about the basics, please join us at the 12:45 session with the creator of the basics, Dr. Ron Ferguson. I hope everyone found some beneficial information shared here today, and enjoy the rest of your day in the summit. And we're going to bid you all farewell.
Thank you, Cheryl, and thank you, everyone.
Thank you. Have a good day. Okay. And I'm going to stop sharing for us, and I'm ending our session. Enjoy your day.
Thank you, Cheryl. We appreciate it.
Bye-bye.